Hey, Liam.
Yeah.
What do you not have to do anymore?
Covered. The door just opened and I did that and I didn't have to. I just realized I don't have to do that anymore.
This is Dr. DeLucia. I'm here with Liam. We're going to take nipple dressings off, pull the drains out. Hopefully we're still friends when I pull those drains out. Right?
Hopefully.
Okay. Liam, what you should expect to see as I'm cutting these stitches, it's going to hurt a little bit. Expect to see black and blue, purple, blood stains, blisters. There's going to be fluid dripping. I'm going to probably peel some black-looking skin, and that's all normal looking to me and for you. It'll be hard for you to look at, but it's the way things look.
Are we pulling first, or are you cutting?
No, I'm going to cut the nipple dressings first.
You guys say pulling. It is inside of you guys.
It is.
We will pull very gently. How's that?
Okay.
So, first things first, we take the nipple dressings off.
I got you with the nose in there.
Let me get some acid tracing and some big band-aids ready. So, Liam, this is going to pinch a little bit. Every once in a while, one of these may hurt a little bit. Remember I said there's going to be black skin on the nipple? That looks absolutely healthy and normal to me. This black skin here is going to peel off, it's going to blister off.
I feel nothing.
And, well, that's good. I may not be able to get it to blister off now, but over time this blisters off and you're going to see purple, red, bloody skin under there.
Okay.
For now, in just a moment, we're going to put some bacitracin on there and a Band-Aid. And that's what I'm going to want you to do every day after your shower. Because after today, you're going to be able to take a full head-to-toe shower.
That's
Probably dying to take, right?
Yes.
Same thing. Now remember I said I took some skin off of the center? So there's some stitches there also holding this together. So you didn't want this big wrinkled mess here. So I had to cut and stitch. So there's a chance we may have some scabs form here, scab form here. Little scab, like a scab on your knee or your elbow when you fell off your bike. The scab falls off, you have an open wound, it slowly heals. But see all the, don't worry about this color, that's fine. This is all really, really healthy. It always looks black like that on the rim, and most of the times the nipple also looks black with a little bit of blistering. You don't see it now, but it'll blister and come off in the next week or two. This is how much bacitracin I want you to use.
Okay.
Even less. That's it. You're not allergic to bacitracin or
No.
Neosporin? Bacitracin.
Neosporin.
You're going to feel, you're going to feel these stitches on your skin. There are stitches there. Those are absorbable. They will melt and fall off over the next month. And the next time I see you in the office, I'll actually pluck what's left. But over the next couple of weeks, these are going to start blistering and coming off. You're going to be weeping. You had almost no blood or fluid coming out of it. You're going to be weeping. The blister's going to come off. You're going to have raw areas of red skin. That's to be expected. And you might have some blackened areas of skin, dead skin. Scabs that'll fall off, and some areas of scarring there as well. These guys you don't need to keep covered. You can if you want to, but you don't need to.
What's the best thing to do to stop them, like,
Scars.
yeah, lessen the scar?
Here's what you can do, but I'm going to recommend you don't do anything yet. I like to wait to see if scars get thick before I tell people to institute treatment. Now, some people will say, hey, I want to prevent scars from getting thick, so they'll go out and buy silicone strips or Band-Aids right now and start putting them on every day. I have no objection to that. It might help. It's very, very expensive. I'd rather see if the scars start to get thick in the next couple of months. That's when I may recommend putting on silicone strips or something I call Scar Guard. Well, I don't call it Scar Guard. It's called Scar Guard. It has vitamin E, it has silicone, and it has steroid in it. It looks like nail polish, and most pharmacies sell it after you shower. You paint it on. It dries like rubber cement, washes off after 4 or 5 more showers, and then you paint some more on. So you can either start using silicone strips, and there'll be instructions about when they don't stick anymore and you can put a new strip on. Or you can go buy Scar Guard in a pharmacy, call the pharmacy first because they don't all carry it. Or you can wait and see if they start to get thick and then we can institute treatment.
And what's the likelihood of them becoming like that one?
It's hard to say. It could be high because, number one, you have a thickened area of scar, although this area here is among the highest risk area. Having said that, these can be thin, or these can be just as thick as this is.
Alright.
So it's up to you. If you want to start instituting treatment, you can start. If you want to wait a month or 2 or 3, now you probably won't see thickened scars for at least 3 months or more. At the earliest I've seen them is 3 months, but usually it's 6 to 9 months that I start to see them. Come on, other side.
Okay, drop them there.
Find the stitch here. I'm going to pull on you a little bit.
Yeah. Good, yeah.
That was tied in nicely. Okay, got it. All right. Take an alcohol swallow. So bacitracin and Band-Aid after your shower. You can shower every day if you want to. You don't have to.
Freaking. It's a little
No, I'm not pulling the drain out yet. I'm milking the drain. I'm going to get every last little drain out of it.
Your famous Dr. DeLucia. It's also for Viviana because she wasn't able to be here.
Okay. All right. Here comes the bad part.
Hmm.
Now,
Don't
what we're
get
going
my
to do
face in
is
it.
we're going to count to 3. I'm going to count to 3.
You're taking them both at the same time?
That's right.
Oh, for fuck's sake.
It's, believe it or not, it's actually less painful. Patients
Okay.
who've had 2 drains per side told me they could tell you that story.
Okay.
On the count of 3,
Mm.
you're going to take a deep breath.
Okay.
During that deep breath, we're going to pull these drains out.
Okay.
It's going to hurt.
Okay.
Did you take a pain pill today?
Took 2. I was
That's
smart.
right. Who gave you that good
Kylie.
advice? Okay. All right, here we go. This is the real thing. Ready? 1, 2, 3. Take a deep breath.
Oh, that is the weirdest feeling ever.
We're going. Now, what's going to happen is, I don't suture those holes closed. They close on their own. But they're going to leak like leaky faucets in the next couple days.
Okay.
Do you want to sit up or do you need help?
I got it.
Take Johnny off. Put your bra, your last bra ever, back on. Oops. This guy. Hold that there for me for a second, if you would. Get your drain hole. Hold that guy.
No.
This guy for me.
I think it's backwards.
Jessica.
Did I give it to you backwards? Oh my god, I'm so sorry.
And you got it on film. Who gave it to her? It wasn't me. It was Jessica. Jessica,
You got
put
it?
on bras before, haven't you?
Yeah.
Liam's thinking this is my last one. The least you can do is put it on right.
Where is it? Where is it? There.
I'm so sorry.
Out of all of the things to have gone wrong, I'm happy it was that one.
Right?
If
I
that's the
am
worst
too.
thing that happens to you, then we're good. All right. Okay, now, whenever you change a dressing on somebody, take a compressive garment on or off, or take nipple dressings off, or pull drains. People can get dizzy or lightheaded, so I want you to lean on back here. We'll watch it for a little while. We'll sit you up here a little bit, and I'll give you some instructions. You can now shower head to toe. You can get all your entire chest wet. What I don't want you doing for 4 weeks after surgery is submerging your chest underwater. In other words, the bathtub is only this high. Don't submerge your chest under the bathtub, swimming pool, ocean, lake, river, etc. But you can wash with soap and water. Use the regular soap water shampoo that you're using. You'll feel the little stitches here. They will slowly melt and fall off over the next month, and the next time I see you, I'll pluck whatever's left off of there. The drain holes are going to close on their own, but they'll take about 2 or 3 days to close. In the meantime, you'll leak a little bit. So we ask you to change your pads, maybe shower, fresh pads, put the surgical bra on. And you can throw this in a wash. Use Clorox or peroxide or not. I need you to continue wearing this. I want this, get this, 4 weeks from surgery, night and day. Taking it off to shower or to wash it. After 4 weeks, I'm going to tell you to wear it for 2 more weeks, 12 hours on, 12 hours off. But I'm going to see you before that time anyways. Again, slowly sitting up so you don't get dizzy or lightheaded and pass out on us gradually. And again, bacitracin.
Can you use
Pads,
Neosporin or
bandages.
does it matter?
You can use Neosporin. Now, what I want you to look out for is when people use bacitracin day after day, especially for a month, some people become allergic to it. even though they've used it all their lives.
Mhm.
Allergic reaction will be a red pimply reaction spreading across your wrists, like a diaper rash on a baby or a yeast infection.
I've seen that on some guys in some of the groups.
Big red,
Mm.
they become allergic to it. It itches, it hurts. You will call and we'll tell you to stop using the Neosporin. And then I will try not to put you on steroids because steroids inhibit wound healing. So if you call with that, I'll say stop using it, switch to Vaseline or Aquaphor. I'll tell you, see if you can get by for the next 2 or 3 days. If you call back 2 or 3 days later and this is just driving you nuts,
Mm.
then we'll put you on some oral steroids that'll clear up the allergic reaction, but also put you at a little higher risk for wound healing complications.
Okay.
So, bacitracin or Neosporin, you can become allergic to any of them. Neosporin has a higher likelihood, in my experience, of causing allergic reactions. So if you don't have one, buy bacitracin. If you have Neosporin at home, that's fine, don't spend extra money. Just look out for allergic reactions.
Okay.
Big Band-Aid or a non-stick pad of some sort. Padding over the drain holes for the next 2 or 3 days.
And Band-Aids on the nipples.
Band-Aids on the nipples. So the padding can stop. That's just to absorb any blood that's coming out of the drain sites. Once the drain sites are closed, you don't need to put any more padding. If you want to wear pads because your scars are sensitive, that's fine too.
Mhm.
If you want to start the silicone strips, that's fine.
Okay.
Because you have a little keloid here, skin tone, a little keloid, you're a little higher risk.
It's my first one, but I got this one like 2 years ago for my
Mhm.
cat, and I'm highly allergic to my cat.
It doesn't mean because you form one here that you'll form it everywhere.
Okay.
And I do find that the central upper portion of the chest is one of the highest risk areas in the body, but because of their skin tone, because of your thick scar there, it wouldn't surprise me.
Okay.
So if you wanted to start institute treatment earlier, that's fine.
Okay. Thank you.
All right. Cut.